In this week's video presentation, this is week 6, we'll be talking about the digestive system. Today is 10/17/2021. My name is Jaime Estrada. Let's begin. We'll be discussing the organs in the digestive system. So here we have the esophagus. The esophagus then connects to the stomach. Okay. Here we have the liver, which is located in the right upper quadrant of the abdominal cavity. We have 2 lobes here. Just below that, we have the gallbladder, and to the left, so the medial, it's inferior to the stomach, but medial, in the medial section here of the abdominal cavity, we have the pancreas. Okay, and then here in the interior medial portion of the cavity, of the abdominal cavity, we have the small intestine. And then here we have the large intestine. We have the rectum, which is this area right here. And then the anus, which is the actual end of the gastrointestinal tract. That's where we defecate. Okay. And then for today's disease that we'll be talking about, we'll be talking about GERD, which is also called acid reflux. So in GERD, patients who suffer from GERD, that is the lower esophageal sphincter, the LES, it fails to close, so it normally closes. So that is actually located right here. So it is a sphincter that is between the stomach and the esophagus. So once the contents enter, the sphincter is supposed to close. So it opens when it relaxes, and it allows the food to pass for digestion, and then it's supposed to close properly. When it doesn't close, some of the contents of the stomach actually leak out. So what happens? Some situations that happen there is it could actually erode the esophageal lining, which can also lead to cancer, heartburn, chest pains, or worsening. It feels like symptoms of asthma where you can't breathe. And that's all due to that acid that actually erodes the lining of the esophagus. There are medical treatments for it. There are 4 types. There are, there's mild, severe, moderate, severe, and chronic. Those are all. It could be due to smoking. It could be due to other genetic conditions, but essentially what it does is just the acid, the valve or the sphincter fails to close, and the acid goes towards the esophagus instead of staying within the stomach for digestion. And that concludes our presentation of week 6 digestive system. Thank you.